This is not a video about why you should be a vegetarian. This is not a video about why you should be a vegan. This is not a video that lists reasons you ought to feel bad about eating meat. This is a video in which we tell you that hospitals should serve more plant-centric food in their cafeterias, and then we tell you why and how that should happen. So there you go. Hospitals should serve more plant-centric food in their cafeterias. Why? You're probably an American. There's a high likelihood that you suffer from a chronic disease like cardiovascular disease or diabetes. If you don't, you probably know at least one or two people who do. After all, 1 in 4 American deaths is caused by cardiovascular disease. Americans eat 70% more meat than the USDA recommends daily. Excessive red meat and especially processed meat consumption have been linked repeatedly with cardiovascular disease and other chronic health issues. Reducing meat consumption lowers the risk of a fatal heart episode. Back to the food and hospitals business. Imagine you're leaving a doctor's appointment where you talked with your physician about your chronic cardiovascular disease, and your doctor reminded you to cut back on red meat again. It's lunchtime, so your first stop is the hospital's cafeteria, where the hot meal options are a sauce-drenched meatloaf, a heavenly-looking chicken salad with some chipotle mayonnaise, and a lumpy-looking tofu thing with lettuce. What are you supposed to do? Eat the gross, lumpy tofu? Now imagine you've had a heart episode, and you're at the hospital for 4 to 6 days recovering. Should you and your visitors have to make the choice between a heart-healthy meal and a good-tasting meal every day? Given how many of a hospital's patients are there for chronic diseases linked to meat consumption, it's just plain confusing that hospital cafeterias don't sell multiple plant-focused and vegetarian options that are just as attractive as their meat offerings. 3.7 million Americans leave the hospital with heart disease as a first listed diagnosis every year, yet the food they get at the hospital can make their problems worse, even though studies have found a reduced risk of heart disease associated with low-meat diets. So what should hospitals do? Just to reassure you, the answer is not to take away all the meat. No, what hospitals should do is work with what they got. Across the country, 340 hospitals have already signed the Healthy Food and Healthcare Pledge sponsored by the Healthcare Without Harm. Many more hospitals are independently planning healthy initiatives. These institutions try to engineer their cafeterias and cafes to encourage patients, visitors, and employees to eat more healthily. This engineering does not remove unhealthy options like chips and meals based on highly refined carbohydrates. Rather, healthy foods are placed strategically at eye level, in the center of an eatery, and near registers so that consumers are more likely to reach for them than inconveniently located junk food. Chefs are tasked with making completely tasty, healthy options. The next step is easy. Treat vegetarian and plant-centric options the same way as healthy options. Plant-focused options should be placed throughout a cafeteria in order to maximize consumption, and meat options placed in a less visible spots or removed from display so they are available upon request only. Even if a plate isn't vegetarian, it could have less meat on it than a traditional entree. For example, instead of serving a full chicken breast with side vegetables, a plate could feature a soup or salad with a few pieces of chicken in it. Most importantly, we should put the same effort into developing delicious, craveable, plant-focused options that we do into more traditional meat-based menus.
Imagine if the hospitals who have pledged to serve healthier food also committed to more plant-centric menus. This could reduce the number of meat meals at-risk Americans consume by over 100 million meals a year.
People trust that hospitals are there to make them healthy. Shouldn't that include the food hospitals provide?